experience that you've had in your communities around climate change and its effects. So I know the introduction kind of introduced climate and health as, being extreme, the health effects related to extreme weather events. But I do want to highlight that it's not only extreme weather events, but it's also these slower events, like slow increases in heat, occurrences of drought, things that are not necessarily seen as an emergency situation, but have huge effects on health, either directly or indirectly through the cascading effects or even the compounding health effects. That's good. Okay, so you can go to the next slide. So just a quick overview, background on climate and health in general, the CDC's climate and health program, climate health and indigenous peoples, some of the work that we're doing and promoting specifically through the National Indian Health Board and its Climate Ready Tribes Initiative, and talk about this. Next slide. So when we talk about the impacts of climate change on health, we're really talking about a whole myriad of issues. As we're seeing temperatures increase in carbon dioxide, more extreme weather events, warmer water, higher sea level, that has a huge range of impacts on air pollution, on the soil, the dryness and the composition of soil, water quality, especially with the warmer water. And then that affects health. So it affects respiratory health as we have more frequent and intense wildfires and the smoke related to that, as some of us are feeling being here in Billings with the wildfire smoke coming down from Canada. It affects also pollen seasons even. So maybe less of an issue here, though we do still see pollen in this area, but pollen seasons are shifting. We have shorter winters and the growing season is starting earlier. And the pollen season is lasting longer and it's more intense with the increase in carbon dioxide. We're seeing changes in vector-borne diseases, ticks and mosquitoes. So those seasons are also growing and their distribution is shifting. So where you might not see certain ticks or mosquitoes, these areas are now experiencing them. And you're starting to see the health effects of that. We see water quality impacts and water quantity impacts. So we're having, some increases in drought or increases in precipitation events, which are causing flooding. With the warmer temperatures, we'll even see, new things pop up like harmful algal blooms, which affects the quality of the water. And then all of this has a huge impact on mental health. So I think specifically speaking with you all, indigenous peoples are much more deeply connected spiritually, physically, emotionally with the environment. And these shifts are being experienced more deeply, and it affects your traditions, your knowledge, your the environment that you grew up in is not the environment that your children may be growing up in. And so, yeah, all of even, one thing I didn't mention, but displacement. So with these extreme weather events, some areas are become uninhabitable and people have to move, and that has great mental health impacts. So when we're talking about, you can go to the next slide. So when we're talking about the impacts of climate change on health, we're really hitting on all of these various sectors of public health. And it really, affects our mission at CDC across all of the different centers and the work that they're doing. Next slide. So I'm in the CDC's climate health program. We're a very small program. We're funded at what would be considered a pilot project level, and we have been for since 2009. Though we are, we have stood up a climate and health task force at CDC to try to integrate climate and health work across the different activities and programs going on at CDC. Next slide. These are the states, cities, tribes, and territories that we funded over since 2009. Some are currently funded and some were previously funded. We do this through both the Climate Ready States and Cities Initiative, which is a cooperative agreement that we have with specifically states and cities. And then we have a critical partnership with the National Indian Health Board, where we're able to fund tribes through that program. Next slide. So when we're funding, health departments to do this work, we're really helping, asking that they implement the Building Resilience Against Climate Effects framework, which is just a process of, I talked about this huge number of issues around climate and health, and how do you tackle that? So this framework helps to identify and prioritize, what is your jurisdiction, your tribe experiencing, who is going to be most affected, and what are some practical solutions that can be implemented. And then of course evaluation and tweaking things and adjusting things, and making sure that you are working within the work that's already being done in your community, not creating something new, but leveraging the work that's already going. Next slide. So I think I already touched on this, but Indigenous peoples are really leading the way in innovative health related to climate change adaptation work using traditional knowledge and novel approaches. So that's really why I want to spend more time talking with you all and learning from you all about what you're experiencing and how you're dealing with these issues. Next slide. So you can keep going. This is a little background on the Climate Ready Tribes Initiative. Keep going. So as I mentioned, here are the tribes that we've been able to fund through the Climate Ready Tribes Initiative. And of course, we have Blackfeet Nation here in Montana. Next slide. I'm going to go through a few examples of the work that they were able to do with our funding. And they identified these projects as being priority and important to them, and put together this incredible work. So I'm just here to, really elevate it. So in the village of Wainwright in Alaska, they identified an issue of, because of the less predictable snowpack and ice, they were having more incidences of people in the winter falling through the ice with snowmobiles. And so they actually distributed these in-reach devices, which was a type of emergency communication device that helped track where emergency rescues were needed and occurred. And so it also helped gather the data and information of where these were happening, so it could be better communicated, where there's less predictable ice in the winter time. So this was not only saving resources, but also lives. In the Seneca Nation of Indians, they were reducing the harmful impact of flooding and stormwater. We know that with flooding, you'll see an elevated risk of vector-borne diseases, and they incorporated this information into some work that they had going on in health communications, so that people could better understand the impacts of flooding and how to prepare and respond to future flooding events. So they really targeted their health communications around flooding for this project. Next slide. The Winnebago tribe in Nebraska is communicating about ecosystem changes in rural communities and how they're shifting and changing, specifically around seasonality and climate change. So, It was really impacting their livelihoods as well as traditional subsistence and wild foods, wildlife, plants, and water for ceremonies and medicines. And so what they additionally did a communication strategy around this to help engage tribal members and focus on rural ecosystem and health needs, and kind of how those changes were happening, and communicating that. Also targeting agriculture and issues around flooding and drought with that. The Lumi Nation is protecting its community from the climate impacts of the warming water. So I touched on this briefly, but when you have warmer waters, you will have these increases in disease, such as those related to harmful algal blooms, and also contaminated shellfish, if that's something that people are relying on and eating. So what they did was an assessment of the warming water and the contamination going on, so that they could communicate that into the community, and hopefully, and reduce the incidence of food and waterborne illnesses. Next slide. The Swinomish Indian tribal community was experiencing storm surges and flooding and erosion as a result from that. So what they did was they developed a climate change health impact assessment and action plan to that really brought together the community on these issues to identify and target interventions that they then implemented. Did a lot of these, I guess. Can we actually just keep rolling, because I want to get to the discussion. Next one. Oh, I want to mention real quick that there has been a project to indigenize our BRACE framework to make it more relevant and valuable to tribes as they are trying to implement the BRACE framework, and so that it better integrates community connection, natural resource security, cultural values and education, self-determination and resilience. So this was a project that was done through the Climate Ready Tribes Initiative, and is a resource that's publicly available, and something that other tribes can use as well in their climate planning for climate planning purposes. Next slide. Some other resources, I will recommend that you check out the Climate Ready Tribes Initiative. I know that National Indian Health Board is working to update the resources that are on their webpage. So you'll be able to kind of link to all of these, but this was an initiative that the Swinomish took on to create online modules to help guide Indigenous communities to actually assess their climate change impacts and adaptation priorities. So that's a great resource as well, and something that is available online. I want to just mention that our cdc.gov/climate and health webpage has lots of trainings and resources to help if your tribe is looking to get more engaged on climate and health initiatives. We have data and tools. I know we were talking about data this morning and the importance of that, and making that information more accessible. We have county and census tract level information through the Environmental Public Health Tracking Network's Data Explorer. And all of that is linked on our website here. Just an example of one of the tools that we have. This is the CDC's Heat and Health Tracker. Heat is actually the largest killer of all environmental disasters combined. It's kind of the silent killer. We don't, it's not something you see when it's really hot outside like it is right now. You look outside and it looks the same, and it doesn't get the same attention as some other extreme weather events, but it is the deadliest. So what we've developed is this heat and health tracker, which has local level information on demographics, vulnerable characteristics, or characteristics of that county that may make it more or less vulnerable to heat, and some resources, as well as tracking actually what the current heat season is and how it tracks against the historical average. That's just another image of that tracker and kind of how you can drill down to that community level information. And we're really trying to make this, as easy to access as possible. So, anyone, you don't have to have a background in epidemiology to go to this website and pull these stats. We really try to make it clear and something easy to use. Okay, this is what I wanted to get to. So I'd really like to hear from you all on the work you're doing on climate and health. And I'll just highlight maybe some of these interventions I mentioned were things that you didn't necessarily think of as climate change adaptations or climate interventions, but as I mentioned, the impacts on health from climate change are vast. And some of these things may not immediately appear to you as a climate intervention, but maybe they do help your community be more resilient to these changes that we're seeing and going to see more of. Also, which climate-related hazards are most impacting your community? What resources or technical assistance could be useful? And I'm taking this information back to my program, and that will help determine our priorities and our work. And what information and knowledge that you have that could be shared with other communities as well. So with that, does this spark any ideas or discussion?
Yes, I have a few comments about the climate change and how it affects water, I guess. And when you say resiliency, I mean, we're picking out the people, but then you gotta look, there's 15 different emergency support functions under emergency manager. Yeah, natural resources is one, but then you gotta look, there's agriculture is one too. And I noticed that like on down, over the past few years on our reservation, they're always, they're trying to go more cultural and environmental and safe things, I guess, or whatever, but and I agree with that stuff. It's just that some of the restrictions that are put on out there affect people's livelihoods through agriculture. And I think what both sides don't see is it's affecting both sides. Yeah, like I know I've noticed this at home. I worked with water for years. Our runoffs are coming sooner. So like they used to come at the end of June or somewhere down there, like I know there's some of them are starting to I mean, the peak hits in May. I mean, like the 1st of May, that's not right. So what's happening is the water runoff comes, the peak water flows, and then it slowly goes down. And a lot of people are still, their growing season's changing, like you said earlier. Some of our growing season up here in up north, it's short no matter what. So even though the water's coming earlier, this growing season is pretty much stayed the same.
Yeah, it's not insane.
Yeah, so it's not insane. We don't have no storage. And I was trying, over there since 1997, I've been fighting for storage for our reservation, and it's a real difficult thing because, like you said, indigenous people are more in tune with the environment. I think they got so far ahead of themselves saying that so much. That now that I try to present the storage thing at, project at home, and we pretty much, I mean. The designs, the site, everything's coming to a close. But it's the acceptance. So they don't want to accept that, because you know, they think, well, agriculture is bad, this is bad, that's bad. We're gonna save the environment, we're gonna keep the water for the fish. Because that's fine and all, that's cool. However, the storage nowadays is not meeting the needs almost of what we utilize even for cultural. Fish habitats, everything. Everything's starting to shrink, you know, even the riparian zones. If we don't get storage. I was trying to tell the people at home, I said, well. I seen a document that came out, I don't know. I can't remember where I seen it, but it was talking about the future. The way that the water is gonna be pretty much projected for our area. We won't have any water, you know. We might have water during runoff. But then that water that you used to see in the river during the off season. It pretty much won't be there, because a lot of it's regulated off of our reservoirs that we have now. Like, once it runs out. And we don't have additional storage. Our future generations are gonna have to go over there. There's not gonna be no fish habitat to save, because there will not be no water in that river. So we're kind of fighting ourselves. I don't know how you get around that. It's just something that's been bothering me for years.
Yeah.
I just thought I'd let you know. Thanks.
Yeah, I appreciate that. I mean, that's what this is presenting, right? So like these conflicting issues or priorities that the community has to grapple with, because there's not enough water. You have to decide between water in the river for the fish or water for agriculture. Oh. Oh,
See, what I'm saying is, yeah, I'm not saying that you have to split the water between the people and split the water between agriculture. They both use it. When we use it, it goes right back to the river. The human consumption, you know, it goes down to the system, down to the ponds, you know, and then back in the river.
okay.
I'm not saying that, I'm saying that we're getting less and less water
Less
in the,
water.
in the time that we need it.
Yeah,
So, 40 to 60 years from now, I said, we're really gonna have a hard time up there, because there might not even be water for the people.
yeah,
We're gonna have water during a certain time of the year
yeah.
when it's runoff after the snow melts. And then I know a lot of places, boy, we get down to, I mean, our rivers get so hot. The pH gets so high, it starts to do what is it? And algae blooms and stuff.
Yeah. Yeah.
Okay, then no, there's those, that problem, but then there's the pH gets so high that the oxygen level, the dissolved oxygen gets so low. That it kills the fish.
Yep.
Okay, now, if we don't have any water coming off the mountain. You know, we stretch it out as long as we can. With the reservoir that we got, which doesn't capture the most of the water anyway, because it already went past us through the spring runoff. Early spring runoff. Okay, now, if there's not no water in the river, what happens then? We're either up in these dry arid states, we're either gonna have storage. Or we're gonna have to start living off the Sioux aquifer or something. We'll drain it just like Albuquerque is doing. All right.
Thank you for your presentation. We enjoyed it. Edward D. from Gannett. couple of thoughts come to mind. By the way, I really agree with you on the fact that the need to indigenize that race framework. I would like to take a stab at it personally, because I have one model that I've been slowly working with by way of my background in sustainability and some of my research I did at Arizona State University in Tempe. So, but
I would like to talk to you because we are actually updating the whole brace model too right now. To be more relevant because it really was developed in this, okay, if you had all the resources in the world and you did it perfectly, what would that look like? But that's not reality. And so we're revisiting that 10 years later after it was developed. And it would be a great time to connect about that.
great, I think I'm willing to chat with you. It's really what it is Mother Earth, Father Sky, which is a depiction of Navajo's 9-night ceremony. It's a really sacred ceremony, but it's being used in other areas within academia, like medicine, law, business, and so forth. So, to your second question of their second bullet. So in the Southwest, primarily on Navajo, the biggest hazard that's impacting our area is ceremonies. Ceremonies have a direct tie or correlation to language. To be able to sing a chant, or say a ceremony, you have to know the meaning of, we call it Daoji, the saying or the symbolism, and even constructing a sand painting. So also based on my research, at one point in the late 19th century, early 20th century, there used to be over 500 sand paintings that the Navajo medicine man and we wanted to use that. And a lot of these sand paintings have contribution from nearby tribes like the Zoomies and the Pueblos, and then some Apaches. So right now, because of climate change, the number of sand paintings that our medicine men now are able to construct is less than 80. So a lot of it is attributed to the language loss as well as climate change. So that's really something that that's really impacting us. Of course, obviously, water and drought is an issue in our area. There was some research that was done at the University of Arizona by a professor named Van Columbi, as well as Robert Cush in the College of Law. So they're using they use grants to study the indigenous people in the former Soviet Union, now Russia, that live on the east coast of Russia now, which is the relatives of the indigenous people from Alaska, the Inuit and Inani. So what they did is they were removed by the former Soviet Union because their home area, which is deeply sacred to them, used that for bombing them. So they relocated them down along the coast. They were up on the hills. So they've been relocated for like 40, 50 years now. But their ceremonies and their language and stories, indigenous knowledge, directly and deeply tied to those hills and the higher elevations of the mountain, which is now a bombing room. What they did here, these two professors, they developed one of the solutions that they developed, I think is useful here for any one of us, for all the tribes. They call it the intergenerational coding of memories. So basically, they, with this few elderly within their communities, they record all the stories, the songs and the chants and traditions about their homeland up on the high elevations, the rivers and the lakes, the fishing and the hunting. Some of it are in their songs. So they basically recorded that, digitized that. Now they're using them to teach the younger generation, the new kids in school. And some of it is used in apprenticeship for their ceremonies to be continued. And I think that's probably a solution I see that could be used for many of the tribes here in the low 48, and certainly with the folks up in Alaska as well. So it's just something that I've always thought about, and I think that's a project or probably a graduate study that students should really dive deep into, and we know it's useful and applied at a practical level practical level with any one of these tribes. So, I just want to share that with you, that our ceremonies has really been deeply impacted right now with our Navajo people. So thank you.
Thank you. Anyone else?
My name's Cornell Snyder. I work with Clint down in Wyoming. I work with lead water grant and lead testing. And I haven't been there too long, probably about a year. And I just wanted to touch on what he touched on about how our traditions are really impacted by climate change. And one thing I really noticed is that my family's all sun dancers. My sisters and brothers, and they all go down to Idaho and do our dances and everything. And it's really been tough these past couple of years, just with how hot everything's getting. And Idaho is really dry. It's really all dust bowl every time you go there. And one thing I really noticed this year is that my sister and my mom, a couple there, my family went down there, and they had a really hard time because it was like 106, maybe a little bit hotter. What they do for Sundance ceremonies is they stand out there, no food, no water, dance for 3 days straight, 3 days, 3 nights, and a lot of them couldn't do it. A lot of them fell or had to be taken out, had to be emergency service. And it was really hard, and it was like a big wake-up call. A couple years ago when I very first started, my grandpa told me that, so that we can't. One day we're not going to be able to do this because it's so hot, and every year it gets a little bit hotter, drier. Same thing with Clint said. Our water, our seasons are really out of whack now, off the balance. We have real intense winters, but they're not as long as they used to be. Our summers are a lot longer. Everything's changing. And I guess what I really wanted to ask is, what would you suggest as, because I've only been in this program about a year, but it's really been interesting, or it's really opened my eyes to see just how much it affects like little things, even like ecosystem, like fish, plants, everything that stuff you wouldn't even think of, insects. And I would just really like to know what your opinion is, what young people these days have a son, you want them to be able to do the things I've done, but it's going to be a different world with being grows up. And it's really would like to know what you would suggest people get into, especially in the CDC, like what kind of programs are coming, like what kind of new, I'd say, things people should study or people should really take an interest in, will affect us down the road. Because it's really been crazy these past 10 years, everything that watch grow up. Yeah, it's a different world. Even here, grandma told me before I came, I think the cold was, it gets cold in Montana. I told her today, I'm like, it's not cold here. I was like, I'm sweating in my hotel room. Holy cow. I'm not built for this, I'm a mountain man. But I just, thank you for presenting. Thank everyone for being here. Just really glad that there's programs like this, and people care about things like this. I would feel like people rush over that. Oh, you're just preaching climate change. You're trying, no, it's a serious thing. It's not going to affect you, maybe per se. It's going to affect your kids and your grandkids and 7 generations. It's really, it's really puts things in perspective.
And it sounds like it is affecting you already, your community. And, I think that that's important when we talk about climate change, is it's not the polar bears and, the Arctic, it's us now, today. It's literally today, the heat advisory and the smoke in the air. We study at CDC the number of people going to emergency rooms for heat and for respiratory issues, and it's increasing, and it's dramatically increasing. So knowledge is power, and I think making data and information more accessible is so important, and data and information that's relevant to at the community level. And so That's what we're trying to do at CDC as far as, preserving indigenous cultures with a changing climate. That's a conversation that is really important and needs to be happening more. I can't speak to it at this, it wouldn't be appropriate for me to speak to it. But this is a great forum to have these conversations about what are others doing, how are they, dealing with the shifting seasons and how that affects their the different ceremonies, rituals, plants that they rely on that might be decreasing, all of this. And that has huge, that's your connection to the environment and to your culture. And that's where, the mental health impacts are so important and critical to highlight. When we talk about climate change and who it's going to affect, we are often referring to frontline communities. And these are communities that are hit first and worst by climate change. And that is indigenous communities. That is indigenous communities are the frontline communities being hit by climate change and are going to be hit the worst, and they're being hit right now. So, I think these forums are great for sharing knowledge and information, and preparedness is so important. We too often in public health, we are given money after the fact, and climate change and the work that we're doing at CDC is really focused on the preparedness side. We're not emergency responders in my program. We are doing the hard work on the front end so that we don't have an emergency that we have to respond to. Or if we do, the health impacts won't be so severe.
Thank you.
So again, thank you to everyone. Thank you so much for your presentation. I think we've all heard the words, as long as the grass grows and the rivers flow. What happens? What happens, right? And I think that you had a great idea about that cistern, right? That collection system, and then you can divert. Yeah, Troy always has really good ideas, right? But as you were saying about, we have to flex and we have to adjust, and whether it's our Sundance times or, it's that flexing, right? That's part of that innovation. Get off of that beaten path of what we think has to be the way, right? So if we don't have water in the river, keep the water in the reservoir for the people, collect the runoff for the agriculture, right? But stormwater. Yeah, but I can't run up a hill anymore either. Yeah, that's an interesting concept, right? But I did want to thank each and every one of you as I look at you and we've talked about being relatives and how we're all connected. Everything is circular, everything is connected, not only people, but in our animals and in our lands. And I did want to remind everyone that this is an incredible amount of information that Dawn has brought with her. And I ask that you take these, right? And take them home and spread the information. There's those fancy little QR codes that I can never figure out, right? But there's a lot of information here and a great sense of resource. What an incredible day. And we have a bit more here to get through, and then we want to wrap up. Pass the mic to our sister here.
I initially had a little more to say, but I think it's just so many, lonely days. But Electricity bills for people who don't have wood stoves on the reservation are ridiculous. This winter, December was bad. My utility ended up being 600. And then, we ran out of wood and we couldn't get wood anywhere. And I grew up on the Navajo reservation where we have to go for food, we have to haul water, we have lived numerous times without water and electricity up here and down there. And it didn't make a difference if my house was out in Billings or if it was in town. It was really hard to get into water service or anything like that. And so it does have a huge impact on mental health. Sometimes you're displaced and then really trying to come back from that right away. And the resources there are really hard to get to. And so I really appreciate that. But I was sitting here thinking, and this is coming to the end of the day, and I agree with what you say. I do go home numerous times a year to get prayers done. And I have to do it because I'm the only sibling that can speak Navajo and understand it. And I was fluent as a child, and being here, it's nice to run into other relatives because I don't really get to speak unless my mom comes up here. And so, and it's true, we have to understand the full meaning of words, and sometimes our words don't translate properly back to English. We don't understand the full words of what we're being told and what's being prayed for. And so, with that, I'm saying, why don't we, everybody here has access, goes past the water source at some point in the day. And maybe what we need to do individually, and it costs nothing, is maybe go walk into the middle of the water and stand there and pray for our water. Huh? Why don't we all just do that? And that's what we can do. We don't need any help from anybody for that. But I have that idea right now, and I think that's what we need to do. And that goes with all health, all of it. Our bodies, our water, our mostly water. This world is mostly made of water. And we really can't solve any of these issues right away. But what we can do is take ourselves to the river and stand there and beg and pray. So I'll leave it at that.
Thank you very much for that. So there's two bus options. We have, Leanna's gonna talk about the bus. You got bus 1, bus 2. And make sure that they know which bus you're gonna be on, because we wanna make sure you all come back from the crowd. We started off, today in a really good way with, good prayer. And I think that, our sister's idea of standing in the water and praying is what we do, right? We started off in a good way with prayer. We had good words today. We shared good information. Somebody needs to start throwing spit water balls or something at me to keep my presentation shorter. But it's been a real honor to be with everyone today. I want to thank all of the presenters. Especially since all of the presenters came with open ears and open hearts to hear what the feedback was. And I think also that I would like to give a shout out to the National Center for Environmental Health at CDC, because they are running up the hill trying to make these things happen. So I want to particularly call out Donata Green. You'll stand up, sister, and acknowledge our sister for her work and diligence in keeping this on track. And Audrey, I'd like to acknowledge Audrey, who works with Donata. And then, of course, there's Sharonda, who is not here, who is actually taking some time off, although we are seeing her online. So we're gonna start like, hey, we're gonna tell the IT people to cut you off, because that's part of it too, right? For our own mental health. Each one of us, no matter how much we work, we have to take care of ourselves. So thank you again for being here. We'll see you again tomorrow. But Leanna now has some announcements about the bus stuff. Enjoy the evening and we will see you tomorrow. And thank you.
So we printed out bus schedules. If you would like to take one with you or take a picture of it, that's whatever your preference is. We have two buses. The first one will be leaving the hotel at 5:30. Yeah, about 25 minutes. We're not gonna leave you. I'm sure it's not actually gonna, drive out of the parking lot at 5:30, so. But try to be down there around that time. The next bus will leave 30 minutes after that, so it's 6 p.m. The buses should, it takes about 5 minutes to an hour to get there. We'll see how the traffic works with that. The first bus to depart in the thoroughfare is planning to leave about 7:30. So if you want to just be there for a little bit, if you go on the first bus, you're welcome to leave on the first bus as well. The next bus will leave at 8:30. Same thing, we'll probably have some wiggle room. We're not gonna pull out of the parking lot and leave at anyone. We do have everyone's, or hopefully have everyone's number. If you haven't already signed up on the sheet in the back, please do include your name and phone number. We don't want to leave you, because I'm sure that Uber ride has been very expensive. But are there any questions about going to the thoroughfare logistics? There should be, we were told there were bus parking. Anything, any questions?
Just a couple logistical additions. For those of you who have not been to a native event like this, bring cash. A lot of vendors are not going to take credit card. And then also, I believe the buses do not have bathrooms, so you're going to want to go before you get on the bus.
There's nothing else. We'll see you downstairs. And thank you so much for your time today.